My name is Melissa Cleater, and I'm a program manager here at the National Fund. Thank you so much for taking time out of your busy schedule to join us for another webinar within our 6-month series for CareerSTAT Employer Best Practices. We're going to start with just a little bit of housekeeping. So if we could go to the next slide. If you're somebody who is just using a computer, you're great, you're all set. If you are somebody who's using a computer and a phone, we ask that you disconnect from your computer audio so that we don't get any of that nasty feedback, and there's some instruction here on how to do that. And then with the next slide, it's also helpful for you to connect your phone to your video. And this is how you do that. So you would join audio here, and this gives you some places where you can find your participant ID number, which you'll need to be able to connect those things. So no heroic efforts are necessary if that feels real complicated, but it is just helpful for us if you are able to do that. So go to the next slide. So this is a high-level overview of what we're going to cover today. We're going to do a welcome, which is right now. Welcome. Thank you so much for joining. And if you could go ahead and just type your name and where you're calling in from in the chat box. It's really great just to see who's joined us and who the colleagues are on the line. And we really appreciate that. And then we're just going to get right into it, right? As we've discussed on some of the previous series, the healthcare sector was hit particularly hard with this crisis, in part because of the need to suspend those elective and preventative care and the revenue loss with that, while also needing staff to be able to address the critical care needs. And we know when budgets are tight that workforce development is often on the chopping block, and it can be a challenge to make that case when so many things are going on. And so our aim today is to provide you all with some insight and some messaging around how good jobs are a competitive advantage and examples of some practice changes to make jobs better so that you can have that information to take to leaders and hopefully make that case as we look to a new normal, whatever that might look like. So similar to racial equity, job quality is a really compelling reason to invest in workforce development in your workers. Once someone understands that a good job gives your business a competitive advantage, as well as viewing your workers as asset, kind of the question changes from can an employer afford to invest in their workers to can an employer afford not to invest in their workers? It's that critical. So as you'll hear, there is no one pathway to creating a good job. And that's because what matters to people varies. It could vary by region, by sector, by a moment in time. For example, I imagine how people rank safety might look a little differently than it did 6 to 8 months ago. So there's lots of different ways, which is good. It means you can adapt it for yourself. So next slide, who are you going to be hearing from today? We have Janice Urbanek, Senior Director of Innovation and Strategy. She's going to start us off by contextualizing the current landscape and how job quality is an advantage within that space. And then I'll chat with Andrea Gillespie, who's a director of the National Fund site Pathways to Work, and Cherie James, who's with Methodist Health System, and who was recognized as a 2019 CareerSTAT Frontline Healthcare Worker Champion, which is always very exciting to bring them on board and be able to share some of those practices. So I'm going to talk with them about how they collaborated to improve a specific position, patient care technicians, and what they've seen thus far from that intervention. So that will be the back half of what we cover today. And now I'm going to kick it over to Janice, who's going to start us with a few hot polls to see some things from the audience.
Okay, so we have 2 questions for you. The first one is, do you think that investing in workers pays off? So go ahead and fill that out on your screen. And then the second question, if everybody's had a chance to fill that out, in which areas, and a screen will pop up, does investing in workers have the most business impact? From your experience, where does the real benefit to the business show up when you invest in your workers? Josh, will we be able to see the results of the poll?
Yes.
Okay, great. We wanted to do this poll just to get a feel for what are you bringing into the room with you today around how you view investment in workers and the benefits that you see from that. Okay, so while we're getting the results of the poll, why don't we move on? Oh, here we go. All right, 100%. Yay, that's good. That's good to see. And then, where does it pay out? Okay, the top one was employee engagement at 55%. Employee competency and advancement at 35 is the next. And then patient experience and community impact. All right, good. That's good to know. Hopefully we'll give you a little bit of additional perspective around some of those other areas because it does show up in a number of different realms. Next slide, please, Josh. Okay, so, you know, people talk about Corona time around where we've kind of lost all sense of like time and space during this, but so I'm going to put you in the Wayback Machine and go back to January, just 9 months ago. And back then, if you recall, we had a booming economy with very low unemployment, and employers just were scrambling to find people to fill their open positions. And in fact, a lot of businesses were being limited in their ability to grow because they couldn't find the people to do the work. So next slide, please. Can we move the next slide? Thank you. And then COVID hit. And so over these last 7 months or so, you know, we've seen nearly 200,000 people die, sadly. And especially sadly that it was disproportionately affecting people of color. People were locked down. People were losing their jobs, tens of millions of people losing their jobs and filing unemployment. And within the health systems, and you all know this more than I do, you had tremendous revenue cuts due to the loss of elective procedures and additional expenses due to COVID, which led to layoffs in the health system just when we needed the health systems as much as we've ever needed them. And then on top of all of that, George Floyd was murdered, which has then sparked nationwide protests. So in the span of just a few months, the whole world changed. Next slide, please. So a lot of people I've heard say, oh, come on, let's just get back to January, right? Let's try to get through this and get back to where we were. Next slide, please. Well, let's take a look at what else was true in January. Yeah, we had a booming economy, but frankly, over 70% of the jobs that were available in most of the country paid less than $51,500 per year. And people had either no benefits or poor benefits like paid sick leave. The reason that $51,500 number is important is that's what a family of 4 needs just to afford the basics. Food, rent, utilities. They don't have anything left over after those expenses to save for a medical emergency or a car that might break down or anything else. So think about that. 70% of the jobs pay less than what a family of 4 needs just to afford the basics. So it's no surprise then that a PricewaterhouseCoopers survey showed that 59% of workers are expressing that personal finances were their greatest source of stress. And another stat that got a fair amount of press was that 40% of Americans didn't have $400 to cover an unexpected expense. 40% of Americans could not come up with $400 in a heartbeat if they needed it. And when you look at this through a racial lens, data indicates that with for families that had a head of household that had a college degree, so a well-educated person, the typical white household had $180,000 in wealth, while the typical Black household had only $23,400. So huge disparities in terms of wealth accumulation when you look at things through a racial lens. So all of that was true in January, even when we had that booming economy. Next slide, please. So what this means is that booming economy that we had was really built on a shaky foundation with far too many low wage, low quality, but yet essential jobs, jobs that we all relied on others to have. And those jobs were creating a large source of trauma and hardship, especially on healthcare workers. And if I were sitting in your shoes thinking about, gosh, I might be losing a lot of people, or perhaps I already have, just due to burnout, fatigue, etc. So when you take a step back and look at this, our economy can really only be strong when it is rooted in the well-being of all. And when I mean all, I mean all. All workers, all races, all genders, all. So as we think about coming out of this pandemic, the National Fund's been talking about this around the need to respond to the immediate needs of workers who are laid off and the people who are sick. We need to recover our economy, get our businesses back open, and get things going again. But most importantly, we need to be thinking about how do we redesign our local economies to be more inclusive. Next slide. So as we think about this redesign, it again is rooted in that well-being of all, but the way that we do it is by creating what we're calling economy boosting jobs. Next slide. Economy boosting jobs are those that pay people enough that they can spend on the basics. They can pay their utility bills, they can get their cars fixed, they can go to the doctor, etc. And when they do that locally, they're boosting the local economy. They're boosting other families, they're boosting the other businesses, and they're boosting their community. Employers who have these economy boosting jobs recognize that their employees are another business's customer, or in your case, it might be a patient. So it becomes this virtuous cycle of people who have these economy boosting jobs spend more locally and then boost everybody else's businesses. Next slide, please. So the way the National Fund thinks about this, when we think about economic prosperity, it really starts with good jobs in the center. And when you have an economy that's built on these economy boosting jobs, it has a ripple effect. So if you look on the left-hand side, you've got the people who are engaged, who are employed in those good jobs. They're an engaged workforce. They're financially stable. They're able to engage more fully at work. They're more productive at work because they're not worried about paying the bills that they have at home. They're more engaged in their children's schools. They're more engaged in their communities. On the right-hand side, from a business perspective, you can gain competitive advantage because businesses or health systems, et cetera, have those engaged workers who are more productive, more attentive to patient needs, have fewer errors, provide better care. And because of that, they're all partners then with the health system or with the business in providing superior value and service to their customers or to their patients. And then the outer ring of this then is the thriving communities, because when you have an engaged workforce and businesses that are thriving, then your communities will thrive. And this really gets to the social determinants of health, because you now have communities that are in strong neighborhoods with good schools, access to healthy food, and quality health care, the true social determinants of health. Next slide, please. So how do we do that? Click one more time, please. We do that by being very intentional as we go through this recovery phase and incentivize the creation of these economy boosting jobs, but be very specific and very focused on racial equity. If the recent events have done anything, it has been raising that awareness of all of the racial inequities in our communities, systemic racism, and we need to be very intentional and very focused on that. Next slide, please. So the National Fund has created a job design framework, which you may or may not have seen, that we consider a menu of options that employers or health systems can use with input from their workers around how can they improve the quality of their jobs. And you can see it's broken out along 3 different pillars of foundational, support, and opportunity. And I have a few on here circled because these are some of the things that you'll hear about in our panel discussion later with Andrea and Cherie around obviously wages and benefits, because I've talked about that, but another very important element of providing respect, treating your workers with respect, providing them with mentors and advancement opportunities. So we consider these, again, this framework as a menu of options, not a mandate. It's everything that you can work with your employees with to identify what the issues and opportunities are and create something that is meaningful for your workers as well as for your health system. Next slide, please. So I want to just give a couple of examples of the what's in it for workers and what's in it for businesses. In terms of outcomes for workers, there were 3 case studies done in the Dallas area that Andrea wrote that covered Parkland Methodist and UT Southwestern. All of these are on the CareerSTAT website. But just to give you a couple of examples of when investments were made in the workers at these health systems, turnover in PCTs was decreased because they were invested in, they felt more respect. Also, the ROSE recognition program helped to highlight the contributions that PCTs were providing. And that, again, led to an increased sense of respect, higher levels of engagement, as well as providing opportunities for advancement. In Boston, through the work of the collaborative that the National Fund has there, through wage increases and better scheduling practices and hour increases, pharmacy techs and nursing assistants saw a 25 to 52% increase in their annual earnings. And then to give you an example from a different sector, in Wichita, a mid-sized manufacturer of about 150 employees instituted a financial wellness program. And what they saw was that 92% of their workers, after they started this financial wellness program, was able to accrue at least $1,000 in emergency savings versus 12% before the program started. But the eye-popping number here is that over the span of about 2 to 3 years that this program was running, those workers were able to either increase their savings or reduce their debt by $900,000. So almost $1 million financial swing in one company of only 150 workers. So think about the impact that that has on their ability to focus at work, be productive at work, and to be engaged in their communities, and how that becomes this economy boosting job. Next slide, we'll talk about the outcomes for workers, for businesses. And this comes out of the CareerSTAT guide for investing in frontline workers and the research that they've found around the positive impacts that job quality has for health systems. For the first one is workforce availability. Health systems have the people that they need. They can hire and retain the workers that they need to provide superior care for their patients. Employee competencies, they have the skills that they need to do their jobs, and then grow their skills to allow them to advance within their careers. They're more engaged, employees are more engaged, they have higher levels of job satisfaction, and as a result, perform better. On the community health side, employers have found their ability to do more local hiring around the neighborhoods that are near to the hospitals or the care centers, but then also to institute anchor strategies. I happen to work with one health system here in Cincinnati where through their supply chain, their procurement process, they, in addition to a typical RFP questions around cost and schedule and reliability, they also asked about the types of jobs that the bidders had and what they were paying their workers and what their turnover was and what their health benefits were, so that they understood that their suppliers who had good jobs were going to deliver and provide better services to the health system. So they were leveraging their anchor status to drive job quality through their supply chain. Patient experience, obviously, if you have more engaged employees and higher levels of employee satisfaction, they're going to deliver better care, which will lead to improved patient satisfaction and patient care, and higher quality care. Again, with fewer errors, fewer rehospitalizations, secondary infections, et cetera. So those are the benefits that are in it for the employer by investing in their workers. So I hope I've been able to illustrate for you what investing in your workers can mean for both the workers as well as for you as an employer. And I believe my contact information is on the next slide, and I will turn it over to Melissa. Thank you.
Thank you so much, Janice. I really appreciate your quick overview and insight into that area. And I will say to the folks on the line, if you have questions, you could go to the Q&A function at the bottom of your screen. So it's different than the chat, but it's similar. And you could add your questions there, and then we will field them. We're going to turn it over now to learn more details around what happened in Dallas. But if you have questions that came up through Janice's, you are welcome to add those, and then we will kind of integrate them as we go through this next conversation. So I think you could pull down the slides, give us a little bit more of a conversation. Oh, we had that poll. I'm so sorry. We have another poll to transition us. And this one is really curious about whether your organization has adapted a nurse preceptor program for other positions. And if you are one of the folks who are answering yes, we would love for you to just chat in the chat box what positions those are. Okay, so I think we can show. Okay. So we have about a 50-50 split between yes and no, and the majority is an unsure. So that is interesting. That gives us a little insight of where folks are, and we're going to hear a little bit more about how that has been done in Dallas. So we'll just start by asking Andrea, Pathways to Work in the Dallas-Fort Worth Hospital Council Foundation helped 3 area hospitals improve PCT positions. Can you tell us a little bit about how the project came to focus specifically on PCTs and the role that Pathways to Work had in that project?
Sure, I'd love to. Good afternoon, everyone. Again, my name is Andrea Gillespie from Dallas, United Way of Metropolitan Dallas. Yeah, our interest in PCTs actually started way before we were able to bring our industry partnership together. Pathways to Work and United Way of Metropolitan Dallas had made an investment in an upskilling program at Parkland Hospital, another CareerSTAT recognition awardee, in upskilling frontline staff in food service and patient transport into patient care technicians, and then providing them additional training and resources so they could get an associate degree in the allied health field. The Parkland Hospital, after they received the grant from us, came back and said, do you know if other hospitals in the area are doing this work that we could learn from? And of course, we weren't sure. But we decided that we would together build a meeting, invite other hospitals in the area to come and share what they were doing with patient care technicians. And so that first meeting was about 4 different hospitals came to that first meeting. And out of that meeting sprung the industry partnership. The industry partnership in its early days were trying to figure out, modeling after what Boston had done with its industry partnership, trying to identify jobs that it could focus on in terms of jobs that that employers were having trouble finding workers, and jobs where employers were having trouble retaining workers. And out of that discussion, we zeroed in on the patient care technician. Basically, we listed all the jobs. We had all the hospitals come together and list all the jobs where they were having trouble finding workers and all the jobs where they were having trouble retaining workers. And then through a consensus building process, they were able to kind of identify the top three jobs in each category, both categories. And from there, what we found out is that patient care technician was the job that most hospitals were concerned with, not only from the vantage point of finding good workers for the position, but also in keeping good workers. And that's when we began to really build job quality strategies for the patient care technician position.
Great. And so can you talk a little bit about, so one of the things that you all did was go into the hospitals and conduct focus groups to learn directly from the workers. Can you share a little bit about that process, what that looked like, and what are some of the key takeaways that you guys obtained through those interviews?
Sure. With 3 of the hospitals in our industry partnership, really believe that it was important to hear from the workers themselves as far as what challenges they were facing in their day-to-day work and what opportunities they see to grow their career. So what we did is that we, in the 3 hospitals, including Methodist, who you'll hear from in a second, we convened focus groups of patient care technicians that had been with the hospital for a year. So we had some that had just started with the hospital, been with the hospital for a year. We have the patient care technicians in some focus groups had been with the hospital upwards of 10 to 15, 18 years. The groups were about 10 to 15 patient care technicians. Some situations we provided lunch. Every focus group we provided gift cards. We had an outside facilitator come in and just ask the patient care technicians a series of questions about their work, what they found exciting about their work, what they found challenging about their work, where they needed help from their employers to figure out where to grow their career. We asked questions about how employers could make the quality of their work better. And so out of that conversation, we came to emerging themes that were held in common with all 3 focus groups. One of the themes were that patient care technicians wanted better recognition. They saw that the nurses and doctors in some cases, especially the nurses, through a national awards program called the DAISY Award, were able to get a lot of recognition for their work. And patient care technicians were flying under the radar, even though in most situations, patient care technicians, in many cases, spend more time with the patients in their most vulnerable states than the doctors or nurses do. So that was one area. The second area is that a lot of the patient care technicians, they wanted to grow their careers. They wanted to figure out where they could be promoted and where they could advance, but they weren't really sure how or what steps to take to get there. And so out of that, we developed some career maps from the patient care technician to a couple other targeted positions like radiology technician, RN, pharmacy technician, respiratory technician. So we could really show the steps in terms of the education training that it would take for a patient care technician to advance into one of those roles. One hospital, particularly Methodist, again, who you'll hear from in a second, was able to even provide the maps and career coaching and educational fairs to the workers so they could really have an idea of what steps they would need to take to get, if they wanted to become a respiratory technician, for example, where they would have to go to school, how much would it cost, and what was the process for enrolling and things of that nature. The third big area where a big thing we saw was just having better feedback loops between the supervisors and the patient care technicians about, how the day-to-day work was going, what could be improved on, what was going well. So the patient care technicians have a place where they could share their concerns with their supervisors in a safe and proactive context and be able to get good feedback from their supervisors in order to really excel in their work. So out of those focus groups, and then probably a fourth area I would say is that a lot of patient care technicians felt that they could use a lot more on-the-job training. A lot of them were hired and kind of provided training on the spot, an ad hoc fashion, and didn't always feel like they were prepared to do their best work. And so they wanted more formalized training to limit the mistakes that they could potentially make and to increase the impact that they would have on their patients. So on-the-job training, better on-the-job training, more recognition, stronger feedback loops between patient care technicians and supervisors, as well as a career maps for showing PCTs how they could advance in their positions, were the four major themes that came out of our focus groups, which the 3 hospitals that held the focus groups decided to work on.
Great.
advancing strategies.
And I think, one of the things to keep in mind is that, it is so important to engage your workers and get that voice, but then you also need to be prepared to respond to what they're telling you, right? And so in the case of Methodist, you all chose to create a PCT Preceptor training program to provide more of that on-the-job training, specifically for PCTs who train or onboard new PCTs. So a little bit of a train the trainer program. And Cherie, I'd love to hear from you a little bit about the decision making around how you all decided what aspects to act on, and then to share just a little bit about the program that you all put in place.
Okay. Well, can you hear me?
If you could speak up a little bit, you are
There
soft.
we go. I'm sorry. There we go. Is that better?
Let's see.
Is that better?
Yes. Okay.
Okay. So one of the things, I'm Cherie, I'm from Methodist Charlton, been a nurse for 17 years, and I always share with other nurses and healthcare workers, your day is going to be made or broke by your relationship with your PCT. I feel like that they are an integral part of our patient experience, even because, like you said, they do spend more time in the patient's room than anybody else. So in 2018, we had a group that got together and we came up with a system-wide nurse preceptor program. Well, shortly after, it was within just a couple of months, it was brought up that, we need to do something for our PCTs. So we took the same program and did not change much of the content because it wasn't necessarily nursing driven. It was something that all of our preceptors could use. So in 2018, we developed an actual PCT preceptor program. The managers would take their top PCTs, they were recommended for the class, and they would come for an 8-hour class during their workday, and they got paid for this. And we would give them the tools that they needed to better train the folks coming in so that we were able to retain our new hire PCTs through having better preceptors. So the PCT preceptors, we gave them the tools that they needed in order to help teach the new ones coming in so that they had a good background for ways and different ways to teach. We also talk about learning styles. So a lot of the PCTs were very interested in the learning styles, and it's just basically how we learn. And most of us will teach the way we learn. So we've given the PCTs the opportunity to have this dialogue with the new hires. Hey, how do you best learn? That way they can teach to that learning style. We also enabled them to be able to give feedback. So many people don't want to say, hey, that's not the way you're supposed to do things. So we've given our PCTs scenarios. We do activities where they give feedback to one another. And they were very appreciative because they didn't know how to give feedback, whether it was good or bad. It's a busy day. Our PCTs they're going 90 miles an hour all the time. So now that they've taken on the task of training a new PCT, we've given them the tools to feel more comfortable in that and to be more effective. And they've really enjoyed being able to give the feedback that's needed. Give them different ways of doing things or better ways, and to also be able to tell them, hey, you're doing a great job. So it's been very well received. Our PCTs have really appreciated that we have recognized the need and recognized them that they need the tools as well to help make their training a success.
Great, thank you. And we did get a request if you could maybe adjust the mic and maybe get a little bit closer, be a little bit louder. That might help, just a little bit. But so I am curious to hear, you've had this in place for a little bit of time now, and I'm curious to hear about what types of benefits you've seen as a result of the PCT Preceptor Training Program, and particularly in the context of COVID, right? What is that looking like for you?
Well, with COVID, we have actually trained our preceptors, our PCT preceptors to, donning and doffing equipment. I mean, who needs to know specific ways to do that? We've trained them how to properly don and doff the equipment. They also can pass that on to their other new hires and their coworkers. hey, you know, we want you to be safe. And that was what it was mostly, for them to feel like they were cared about and that we wanted to take the time to make sure that they were safe and help them, you know, maybe cluster care and to be able to better serve their patients in the midst of, you know, shortages of supplies. Are we putting it on properly? Are we getting infected? They didn't want to take things home to their family. They didn't want their family at risk for potentially, you know, giving them COVID as they might have picked it up from work. So they were very appreciative with the effort that we've given to ensure that they're safe and that they can train others safely as well.
Great. And do you feel like having those PCTs who were better trained, were better able to respond to that crisis internally, better able to be nimble to kind of make whatever changes you all needed to make to address COVID?
Absolutely. We've also found, you know, if you can explain and have them understand the whys behind what we're doing, you can see them light up and go, oh, I get it now, I understand. And we did find that some of it was a lack of knowledge. And on our part, you know, we should have provided them with that. When they have that knowledge, I like the fact that they do go out, they share it, one will hear it or hear it in a way where they really understand it. And they take the time to even go out and give this information, not just to our new people, but to the ones that they've been working side by side, you know, like Andrea said, a year, 15 years, 18 years. They learn new things and they appreciate that we have invested in them, much like we invest in our other disciplines.
Great. And so Janice alluded to, and as did Andrea, this recognition coming out of these focus group was a big deal, that they felt that they were undervalued for their contributions and not being fully recognized for what they bring to the table and the work that they're doing. And, you know, and we talked a little bit about the ROSE program, and I know that started with your folks, your colleagues within Parkland in Dallas, and that it became so popular there that that you also adapted that program. And so I would love to hear just a little bit more about that program and how it works at Methodist, and then also some of the other ways that you all, some of the other ways that you guys are recognizing your workers.
Absolutely. My director had been a part of the meetings and whatnot, and she was so excited when she came back when she heard about the Rose Award, because, you know, we have the Daisy Award for the nurses, and oftentimes the PCTs would even say, well, what do we have? And it's hard to say nothing. So we were really excited when we started doing the Rose Awards. It has been very well received from our PCTs. And we have started to take the time to recognize them separately from nursing, because you always get nursing services. Well, nursing services are not just nurses. And we felt like some of our PCTs were just swept up under the carpet and not looked at as their own. So we came up with a celebration separate from Nurses Week. So we celebrate our PCTs, and they'll get a week celebration once a year. And we have a breakfast a couple of days that week. That way, you know, we can ensure that a vast majority get to participate. And we also will go around with a candy cart per se. So we decorate up a cart. We do little flyers and posters where the units can post those, and it says, we appreciate you. And they also, the staff members will sign it, so that it's kind of like a big card on each one of the units to all of our PCTs saying, hey, we appreciate you and what you do. We also give them gifts, much like the nurses will get a gift during Nurses Week. So we've adopted that for our PCTs, and they really, you can tell, or I can tell, that they are so excited and thrilled that they're not just, oh, I'm just a PCT, because that breaks my heart when I hear that. So they know that they are appreciated, and we do get feedback and input. One thing that we also started is a PCT class, and after they've been a PCT, a new hire, we started with our new hires, and we're bringing in some of the other ones later. But after a month of being hired on as a PCT, we have an 8-hour class for them. It's not the Preceptor class, but it's for the PCTs, and we go over the things that they're supposed to know, that they already know, but they get a little bit of training on the units. And then after a month, we bring them back and we talk about I's and O's, the importance of, and the highs and lows of blood sugars and the blood pressures that they take and the importance of. So they do get on the job training, but then we bring them back after they've been exposed to the patients on the units, and then we do more education with them. And that's been very well received from our staff as well as from our leadership.
That's great. So we do have one question, and I encourage folks who might have questions to add them to the Q&A box. But we do have one question that is curious, Andrea, whether or not there's an opportunity. So I'm not sure if Laura is ready, or maybe she wants to not ask her question verbally and put it in the chat. But we do have another that came through that says, how do you define, the role of PCT versus nursing assistant? So I know that there's a lot of different terms or titles that people use across the health care system. So is that the same for you all? Are they interchangeable? What are the minimum qualifications for being able to do that, for that position?
Do you want me to answer that one?
Yeah.
Okay, so we have the two categories we had were PCTs, which were the patient care technicians, and then we had PCAs, and they were certified nursing assistants. So we no longer, I know at this campus, but I'm not sure throughout the health system if any of PCAs are hired at this point. We're strictly PCTs. The PCT was they drew blood, where our PCAs did not. They were mostly an assistant. Our PCTs are able to, they're able to remove IVs, they're able to remove Foleys, they draw blood, and of course they are trained on the highs and lows, like I said, of any of the blood pressures we get, the blood sugars. So I'm not 100% sure any more in depth into that, but our PCTs do a little bit more than the PCAs were doing initially. However, at this point, I don't believe that, I know at Charlton we're not, but I don't think at any of the health systems we're actually just hiring the assistants. These are technicians. It's a higher grade. I'm not exactly sure how that equates to money-wise, but I know our PCTs were a little bit higher than our PCAs.
Okay, great. Thank you for that. And then this is for Andrea and Cherie. You know, as folks who have done this work and implemented practice changes to improve jobs, I'm curious if you have any advice for someone, whether they're an intermediary, a partner, or an employer themselves who are interested in making similar practice changes or engaging in job quality work. And Janice, if you have something to contribute, you can do this as well. Like, we'll take all advice that anybody has around doing some of this work.
Yeah, I'll start first. I think that for us, we just started with a basic conversation with the hospitals around the table about, you know, where were they struggling to keep good people, and where they were struggling to find people. You know, and out of that, you know, we realized that the patient care technician was a position that checked both of those boxes. So I think just starting with that conversation. And then, you know, another thing that we did is once we zeroed in on the patient care technician, we had the hospitals actually run data about, you know, what the headcounts were, what the vacancy rate was, what the turnover rate was. And a lot of cases, the data kind of supported their hunches that they were really having trouble keeping good people and finding people to fill the roles. So I think just starting with that basic conversation is a great place to start. And then backing it up with the data just to make sure that our hunches are right on track with what we're thinking about the job.
So what I'm hearing you say is that when engaging employers, you start with what challenges do you have or what do you need, as opposed to how can I help you make your jobs better?
Yeah, I really want them to really drive that conversation and really kind of vocalize, you know, where their challenges are. And then from there, you can really start to, you know, really what happened was the focus group really, the responses from the focus groups really in a lot of cases perfectly aligned with the job quality framework that Janice shared with us, that they spoke about all of those same things about, you know, getting respect, you know, having clear expectations, you know, having some sense of being able to communicate with supervisors effectively and efficiently. You know, all of those things really showed up in the focus groups that also are in the job quality framework. You know, I think that probably another thing I would do is, you know, is encourage the employers to talk with their workers in a focus group setting and really try to understand, once you have the data, you know, what are some of the, you know, what are some of the major things that the workers can share is pretty important.
And from our standpoint at Methodist, we have to be competitive in the job market, because if, you know, if there's somewhere else that's going to pay more, which there always will be somebody else that pays more. So in order to keep our workers, we are competitive as far as, like I said, the money, but you have to make them feel welcome. You have to make them feel wanted, respected. And it's a huge payoff, especially for PCTs. They're the ones that really touch our patients. They hear things from the patients that sometimes the nurses don't. So I feel like we really need to invest in them. They want to be heard. They want to know that if they have issues, barriers, they want to be heard and also celebrated. They want to be celebrated as well. And so that's one of the things that I've really enjoyed the most, was being able to reach out to them, to celebrate with them, and to help them overcome the obstacles. And I think it's a huge, it's a very low monetary thing that we do, which has great monetary outcomes. You've got your patient satisfaction, you've got happy workers, better quality. So, you know, it does come down to the dollar one way or the other. It's a very minimal investment for a great return on that investment.
Yeah, that's great. And we have a question around the ROSE program. So I know that it started with at Parkland, and then you adapted it at Methodist. From what I understand, it is not associated with an external organization like the ROSE, but I am curious if you are aware of any additional thoughts or plans to expand it elsewhere. Do you know if there's any other interest within the consortium or the industry partnership, or at a city level with Dallas?
I know that we do it, and all of our health, there's 4 health systems. Actually, we're fixing to open a 5th in Midlothian, so there'll be 5 of us in our system, and I know that all of us are adopting the ROSE Award. We were the first one in our health system to be able to start that, and like I said, it's a very minimal investment to be able to just, for people to sit down and say, hey, this is where this PCT has done a really great job. We go up, we present them with their pen, we present them roses. There's a banner that stays up on their unit for the quarter, because right now I believe we're doing it once a quarter, and they're so grateful for it. And when they win it, they're celebrated on their unit by the nurses, by everyone, and it's been very well received.
That's great. And you talk about it being low investment. Do you have any ballpark figure about, you know, how much doing that recognition costs?
That I do not have, but I will tell you the banner was probably a one-time cost. Well, it was a one-time cost because it moves to where the PCT, to their unit. And the pins, if I'm not mistaken, the pins are probably between $5 and $8 a piece. So it's not high dollar at all. It's very easy to do, and on our part, like I said, on our part, it's nothing, but for them, for the PCTs, for their fellow coworkers, it's huge. I cannot express enough that the simple things that we can do is so appreciated by our PCTs. Just very simple things.
Okay. And there are some folks who in leadership was involved at the table for those initial conversations. And I think that might be for Andrea with engaging those employers.
Yeah, we had a combination of senior HR staff and assistant nursing officers that participated in the initial meetings. We also had somebody from diversity and inclusion that participated in our early meetings as well. So it was a combination really of HR and clinical staff that were at the table. but assistant, but I would say that the highest level of like job category of leadership we would have at our meetings is like the assistant chief nursing officer.
And then Cherie, who was at your tables, internally around implementing these programs?
So our HR, our senior HR director over the whole system, our HR partner here from Charlton, who also is on our diversity and inclusion. So you may have been speaking one and the same in that, Andrea. And my director, the director of nursing education and professional development. So she was there as well. And she is very much on board with and is excited as the rest of us for, the ability and knowing that this is what's out there for us to be able to do it. We're also looking at, and our senior HR director as well, looking at a level or tiers for our PCTs, much like we do with the nursing. We have a clinical advancement program for the nurses, and there's money attached to it. And the PCTs would say, hey, why don't we get paid to Preceptor? And it breaks my heart to really not have an answer, but at least now I'm able to say it is definitely being looked at and hopefully will come to fruition. But we're also looking at giving them professional growth so that we can adopt the tier scale for them, which will also be a different monetary value for each tier. So very excited about that.
Great. And I think that touched on our last question a little bit, but let me just ask it in case you have more to add. And that was, if someone's interested in more information on the career path information and education information provided to the PCTs. So it sounds like, a little bit of that was in that last answer, but if there's more to add to that, I would love to hear it.
Actually, through the Department of Nursing Education and Professional Development, we have programs where, like Andrea was speaking of, where you can go and work with a radiology tech. So we spearhead all that down here in the Education Department. Anytime we have, which is kind of nice, anytime our senior leaders, our CNO, whatnot, wants to do something with our PCTs or for, they will go to my boss because she's on these consortiums and she hears what's going on in our community. And we don't want our folks to feel like they've been left out. So we take the opportunities that we can to help them advance. We've got one of our PCTs. She was a very leader on one of our units as a PCT, and she's even gone back through Methodist Health System and went and got her RN. So she is now currently one of our nurse residents. So we have to appreciate, understand, and hear those frontline workers, hear what their needs are, and do our best to meet them.
Yes, absolutely. And I will add, when Methodist was recognized as a champion for their investment in frontline workers, a big portion about that was around their education and training for their career pathways. So there's some information on the CareerSTAT website that has a profile on Methodist, and you can learn a little bit more about that work. And then of course you can always reach out directly, either to me, and I can connect you directly to the employers so that you can get some one-on-one and take a deeper dive if there was something here. So I am going to pause us for any additional questions. So there were a few that we didn't get to, and I apologize, but I can follow up separately. I'm going to ask Josh to put our slides back up because we're going to do a little reflection. And so I always like to just check in with folks this is our way of seeing what was valuable. And I would love to hear one thing that you heard today that resonated with you or sparked a new idea. So if folks could just enter that in the chat. Doesn't need to be deep, but just something that came to you that clicked or that you're interested in learning more about. Would love to hear about that. And then while you're thinking and typing, we can go to the next slide just to give you a little sneak preview and a save the date for our next call, which I imagine is going to be of great interest because it's money. So we're going to have some folks on the line sharing about how they successfully shared some grants, and we're going to have our Director of Development, Andrea, sharing just some general tips and tricks around securing grants. So mark your calendar for October 21st. The registration information will be going out shortly, and so you can reserve your spot for that. hot topics. But as always, everything is recorded and everything will be available to the network after. So if you're not able to make it, you can still access the information. So I have a few more. I just want to take a final moment to thank our presenters for carving out time today. This was really interesting and helpful just to hear from, go from the big picture to actually how this happens on the ground. I've really appreciated from hearing everybody. So thank you to all the presenters, and thank you to everybody who showed up on the call. I really appreciate you all taking time out when there's so many things going on. So thank you so much to everybody. Have a great afternoon, and we will see you next month on October 21st.
Thank you.
Bye, everyone.